You have a fever. You're getting weaker. There is no medicine. Wait, if there was no medicine, how did anyone survive getting sick at all? Let's follow one person through it. A hunter, part of a small tribe, tens of thousands of years ago. One morning, he wakes up burning hot. His stomach twists. He can barely stand. The group notices immediately. Someone touches his forehead, feels the heat, and says nothing, because everyone already knows what this could mean. So what actually happens next? Someone in the group goes searching. Not randomly. This person has done this before, has seen fevers like this, has learned, through years of watching others get sick, and either survive or not, which plants seem to help. They come back with bark, with certain leaves, maybe with honey, to pack into a wound if there is one. But here's where we need to be honest, because this is where a lot of people get the story wrong. This isn't ancient people accidentally inventing antibiotics. They had no idea what bacteria was, no idea what a virus was. They didn't understand why these remedies sometimes worked. They just knew, through generations of trial and painful error, that certain things seemed to help, and certain things didn't. Some of what they used genuinely had real effects. Willow bark, for example, contains a compound chemically similar to aspirin. But plenty of other remedies did nothing at all. And some, honestly, probably made things worse. Back to our hunter. He's given water, some crushed plant material, and he's told to rest. The group doesn't leave him. Someone stays close, checking on him through the night. And this is the first real, wait, what moment in this story. Because survival here wasn't really about medicine at all. It was about the fact that someone else was willing to stay. Archaeologists have actually found something that proves this in a way that's hard to argue with. Skeletons of ancient humans who survived catastrophic injuries, broken legs, missing limbs, for years after the injury happened. That is medically impossible without someone else consistently bringing them food, water, protection, for months, maybe years. Cooperation itself was survival technology, as real as any remedy. Let's stay with this a moment, because it's worth understanding just how deep this knowledge actually ran. This wasn't one tribe getting lucky once. Ancient Egyptians documented over 700 different remedies on papyrus scrolls. Everything from moldy bread applied to open wounds, to honey and animal fat used as a crude but surprisingly effective antiseptic dressing. On the other side of the world, ancient Chinese healers were independently cataloging hundreds of medicinal herbs, building a structured system of diagnosis passed down for generations. In the Americas, indigenous cultures developed their own separate pharmacy of bark and root and leaf. Willow for pain, echinacea for infection, foxglove for the heart, a plant that would eventually become the basis for modern heart medication. None of these cultures had ever spoken to each other. They were all running the same brutal experiment, in total isolation, and arriving at strangely similar answers. Now, second night. Our hunter's fever hasn't broken. It's gotten worse. This is where the story gets uncomfortable, and where we have to be honest again. Sometimes, the remedies worked, and sometimes, they simply didn't, because the group had no way of actually understanding what was attacking his body. If it was a bacterial infection spreading through his bloodstream, there was, genuinely, nothing they could do. No willow bark fixes sepsis. This is the part of the story most videos skip, because it's uncomfortable. But it's the truth. For most of human history, average life expectancy hovered around 30 years, largely because childhood illness and infection killed constantly, and there was often no way to stop it. The elder who found the herbs sits with him now too, not because there's anything new to offer. The plants have already been given, the wound already dressed. She sits because that's what's left to do. And this, more than anything, tells you something about what medicine actually meant to these people. It wasn't just a treatment, it was a presence. So, did our hunter survive? Here's the biggest, wait what, moment in this whole story. The honest answer is, it depended almost entirely on luck, biology, and how strong his body's own immune response was, far more than on anything the tribe actually did for him. Some people's immune systems could fight off infections that would kill someone else in the exact same tribe, with the exact same care, the exact same remedies. Survival wasn't really a formula. It was closer to a dice roll, where community care and natural remedies could tilt the odds slightly, but never guarantee anything. This is also why, when real epidemics hit, diseases nobody understood, spreading in ways nobody could see coming. Entire communities could be wiped out within weeks. Archaeologists have found ancient settlements that appear to have been abandoned overnight. Entire populations simply gone, with no survivors left to explain what happened. With zero concept of germs, some tribes turned to ritual, to spiritual explanation, to symbolic healing, not because it cured anything, but because when you have no understanding of why people around you keep dying, having any explanation at all is the difference between despair and the will to keep going. And here's something worth knowing, because it changes how you should think about all of this. A surprising amount of what we now call modern medicine has direct roots in exactly this kind of desperate trial and error. Aspirin, discovered through willow bark. Quinine, used to treat malaria for centuries before anyone understood the disease even existed, discovered through the bark of a South American tree. Morphine, extracted from opium poppies, used for pain relief long before anyone understood pharmacology as a science. And in one of the strangest discoveries archaeologists have made, skulls with holes deliberately drilled into them, a procedure called trepanation. And on many of these skulls, the bone shows clear signs of healing after the surgery. That means the patient survived. Thousands of years before anesthesia existed. We didn't invent medicine from nothing. In a clean laboratory, starting from zero, we built it on top of tens of thousands of years of desperate, high-stakes guesswork by people who had absolutely nothing to lose by trying. So how did ancient humans survive without medicine? The uncomfortable answer is, they didn't always. The ones who survived weren't magically immune, and they weren't following some perfect ancient system we've since forgotten. They had knowledge, they had luck, they had biology on their side sometimes, and against them other times. And perhaps most importantly, they had other humans, willing to stay. Medicine changed how often humans survive sickness. But caring for the sick may have started long before medicine itself ever did.